Okay, so good evening, one and all. On behalf of the weekly webinar series conducted by IEEE Malabar Subsection, I extend a warm welcome to each one of you gathered here for the 40th webinar on recent trends in biosignal analysis for mental health. Today, we are honored to have with us Dr. Subha D Puthankattil, Associate Professor, Department of Electrical Engineering, NIT Calicut. She completed her BTech and MTech in Electrical Engineering from CET Trivandrum and PhD in Biomedical Engineering from NIT Calicut. Dr. Subha DP has authored and co-authored multiple peer-reviewed scientific papers and presented works at many national and international conferences. She has to her credit of acclaimed recognition from honorable subject experts around the world. With a teaching experience of spanning more than 20 years, she is an active member of IEEE and EMBS chapter. She has completed several research projects with grants like nonlinear analysis of EEG signals of patients with Alzheimer's disease, effect of power electronic devices on protective relays, and power quality problem in educational institutions and mitigation techniques. With huge respect, let me now invite Dr. Subha D Puthankattil to start over the session. Over to you, ma'am.
Oh, thank you very much for that nice introduction. So good evening, one and all. So I am Subha from Electrical Engineering Department of NIT Calicut. Let me on the onset thank IEEE Malabar Subsection for giving me this opportunity to deliver this talk on recent trends in biosignal analysis for mental health in this weekly webinar series. Thank you. Thank you once again. So I shall move on to my talk. So the talk is on recent trends in biosignal analysis for mental health. So mental health is actually a major cause of concern in this pandemic period due to many reasons. It could be, Okay, so it is of a major concern mainly due to this pandemic, and it has been due to various reasons, and one of the primary reasons is due to the loss of job and hence loss of income. But above and all, mental health is more than just the absence of any mental disorder or disability. Now it has, this mental health is a major cause of concern, and it has greatly affected low income and middle income countries. So now let us see what is this mental health on. See, we all speak about mental health. Now when we say, if we don't have a sound mental health, it is very difficult to continue with our day-to-day activities. So it is very essential for a person to have a sound mental health in order to perform efficiently and in order to pursue his well-being, his happiness, and so on. And also, it is very essential to restore mental health or retrieve the mental health, because if you want to have proper interaction in the society, if you want to have a interaction with the individuals or your peer group, unless you have a sound mental health, it is very difficult to do so. So mental health is of a great concern, and it is of utmost importance in our daily life. Okay, so let us see the idea behind mental health. So it refers to our cognitive, behavioral, psychological, emotional, and social well-being. Cognitive in the sense, it relates to our intellectual activities such as thinking, reasoning, judgment, problem-solving capabilities, and all these functions are associated with cognitive well-being. Then behavioral well-being, psychological well-being, emotional and social well-being. Okay, so all these are associated with, so unless you have a sound mental health, all these would be in trouble. So there are 300 mental disorders which are listed in DSM-5, which is basically Diagnostic and Statistical Manual of Mental Disorders, which is put forth by APA, which is American Psychiatric Association, and it gives you the standard classification of mental disorders. Now, World Health, so this is a report as per World Health Organization. So kindly excuse, I'll just try to minimize the screen which is propping up in between. Okay, sorry. So mental health is a state of well-being in which an individual realizes his or her own capabilities or abilities, can cope with the normal stresses of life, and can work productively and is able to make a contribution to his or her community. So this is what is the significance of having a sound mental health. That means if you have a sound mental health, you would be able to perform very efficiently. You would be able to cope up with the daily stress in your life, and you will be able to work productively, and you would also be able to contribute very well to your society. Okay, so this is the definition as per WHO. Okay, and WHO has launched in 2019 the Special Initiative for Mental Health, and which actually spans from 2019 to 2023, which is a universal health coverage for mental health to ensure access to quality and affordable care for mental health conditions in 12 priority countries. So these are all the initiatives, because now it has been very well noted and admitted by WHO that mental health is of a serious concern. So that is why they have floated many schemes which would give a better coverage considering the mental health in different countries. Okay, so this is the WHO report as per Indian statistics. It estimates that 7.5% Indians suffer from some sort of mental disorders. And according to the reports, 56 million Indians suffer from depression, and another 38 million Indians suffer from anxiety disorders. Now let us see, in the future slides, we would see that these depression and anxiety disorders are all coming under the classification of mental disorders. Okay, now these two reports are as per WHO reports statistics done in the month of October 2020. So there has been a Mental Health Care Act which is being floated in 2017 in India, which is basically an act to provide for mental health care and services for persons with mental illness, and to protect, promote, and fulfill the rights of such persons during delivery of mental health care and services, and for matters connected therewith or incidental thereto. So this is the Mental Health Care Act, which has been floated by India for promotion of mental health care. Okay, in India. And that too, it has been floated in 2017, accepting the fact that this is of a serious concern. Okay, now the different types of mental illnesses are mood disorders such as depression or bipolar disorder, unipolar. So basically depression is classified as unipolar depression or bipolar depression. Unipolar depression is during the instance when the person is suffering or is diagnosed with depression at its onset. Bipolar disorder, when the person would have successive episodes, or later it would lead to a mania. And then anxiety disorders are also classified under mental illness, personality disorders, psychotic disorders such as schizophrenia. So those people who are suffering from schizophrenia sometimes may have depression. Then eating disorders, trauma-related disorders such as post-traumatic stress disorder, substance abuse disorders, all these are basically classified under the types of mental illness. So that is as per the report which is collected from the government of Australia. And so the mental disorder which I would be dealing with, or which I would be talking on, would be depression, because there are certain studies which has been conducted by me in the field of depression. So depression is among the leading causes of disability worldwide as per WHO reports, and it affects more than 264 million worldwide of all ages. Now, the report when I had collected way back in 2012, it was just depression affecting just 121 million worldwide of all ages. But now, see, when it has become 2021, see, it is affecting more than 264 million worldwide of all ages. So there is no distinction as that depression affects only age group of certain age group from 30 to 90 or so. There is no such restriction. It can affect any age group. So it affects more than 264 million worldwide of all ages, and it is a major contributor to the overall global burden of diseases. So now let us see what depression is. Depression is basically a mental disorder which is accompanied by mood variations affecting the thought process. So in effect, to tell you, it basically affects the thought process. Later, it starts creeping into your daily activities, and it will affect your social well-being. It would affect your physical well-being and so on. So basically, you would be leading to a state, you would be led to a state where it becomes very difficult to maintain or conduct routine activities. Okay, so sometimes there are instances where depression leads to suicide too. Okay. Now the depression types. So prior to dealing with the depression types, let us see. During depression, people suffer from anxiety symptoms, disturbed. So these are some of the symptoms associated with depression. They have anxiety symptoms, disturbed sleep and appetite, and may have also feelings of guilt or low self-worth, poor concentration, and so on. See, always people may have the feeling that I am not capable enough to do my job, or maybe people would find it very difficult to concentrate on their job or on the activities which they perform. You have a disturbed sleep and you don't feel the hunger, and maybe you would be highly anxious. So these are some of the common symptoms associated with depression. Now, it is categorized as mild, moderate, and severe. And there is a scale which is available for assessing the different levels of depression. And it is known as the SUNG scale, SUNG, the SUNG scale, which helps you to assess the level of depression, whether it is mild, moderate, and severe. It is based on a questionnaire which is 20 number, and if the score is ranging from 50 to 69, it asserts that the person is suffering from depression, and if the range is more than 69, it is a form of severe depression. So it is the SUNG scale which helps you to assess the levels of depression. Now, the statistics also states that more women are affected by depression than men. Effective psychological and pharmacological treatments are available for moderate and severe depression. So psychological treatments include behavioral activation, cognitive behavioral therapy, interpersonal psychotherapy, and pharmacological treatments include antidepressant medications. So these are all the informations which are being collected from the literatures and sites. So the sites from which I have referred to are all being noted at the bottom. So you can refer to in case if you require so. So these are all the inputs or informations collected from the internet sources. So now, see, till now, people have been, the conventional method which has been adopted by psychiatrists and psychologists are through number of sittings where they pose questions regarding their symptoms, family history, and so on. But it is basically a time-consuming process because the person would have to have many number of sittings. see, with 2 sittings, the clinician would be able to diagnose, but then many number of the people would be called for many number of sittings in order to have the diagnosis, or in order to have what level of symptom it is, what level of depression it is or so. In order to assess it properly, the clinicians or the psychiatrists would have more than 2 sittings. Okay, so we are going to we are going to float this biosignal as a potential biomarker for detecting or screening or analyzing depression. So we as engineers are going to float biosignals, or put forth biosignals as potential biomarkers. So the potential biomarkers which are currently being in active research are EEG signals and MRI scans. Okay, so EEG signals are currently being used to analyze the changes occurring in the brain when the symptoms of depression are visible in a person. So if you record EEG signals from a person suffering from depression, and if you make an analysis, or if you extract the features and try to compare it with that of the features extracted from the EEG signals recorded from the brain of an active person, you would be able to find out that there would be a clear-cut distinction between the signals. There would be we will not be able to make out anything by visually observing the signals, but if you extract the features from the signals, you would be able to clearly distinguish between the signals of depression patients and the signals from normal controls using EEG signals. Now, there are certain studies which have come up using MRI scans, where that is also able to detect physical and functional changes in the brain during major depression. So diagnosis of depression has also been active in the research field from speech. So there are many literatures which are coming up in the recent years, where see, it is very difficult to have a database in depression. Even if you search for the databases in depression, you would hardly get any. But if you search for databases in depression regarding audio, visual, emotional, and depression recognition, then you could observe that the databases corresponding to ABEC 2013 and ABEC 2014 would be available. That corresponds to audio, visual, emotion, and depression recognition challenge. That has been a challenge which has been floated in, I think so, in the year of 2013. So after which many papers have started coming up in with the research conducted in the databases from ABEC 2013 and ABEC 2014, where they are able to diagnose, screen, and analyze depression from speech signals. So we could use all these biosignals as potential biomarkers, rather than extending it to the conventional state-of-art methods through multiple sittings. Okay, and this is also time consuming and would also help or aid the clinicians with a computer aided diagnosis, which would be faster enough and which would be more accurate. Okay, so these biosignals as potential biomarkers would always help in a computer aided diagnosis, and it would help the diagnosis by the psychiatrists or mental health clinicians. So let us see what are biosignals. So we have seen what is mental health. We have seen what is depression, because we have seen depression as a part of a mental disorder. Now we would see how we would approach these biosignals in order to decipher the information associated with the biosignals. So biosignals are basically complex in nature, which are being recorded from the body, living body, and these signals could be periodic, aperiodic, non-linear and non-stationary in nature. You know, periodic and aperiodic, isn't it? ECG signals are best examples for it, where ECG signals are nothing but records the electrical activity from the heart. These are periodic. Why? Because that typical specific pattern actually repeats after regular intervals of time, and so we call it as periodic. Now, it is aperiodic when it doesn't repeat after regular intervals of time, when it is nonlinear and non-static. But ECG signals are neither nonlinear, not non-stationary, but they are periodic signals. But other types of signals like EEG, EMG, ENG are all nonlinear and non-stationary in nature. Nonlinear means that doesn't satisfy the superposition principle nor the scaling properties, and non-stationary means the mean variance across the time doesn't remain the same. They all vary, the time period, the frequency, all vary as variables. Okay, so these signals could either be periodic, these biosignals could either be periodic, aperiodic, non-linear, or non-stationary in nature. So we have seen that ECG signals are basically periodic in nature, and we would see some examples of the biosignal. So one of it is electrocorticogram, which records electrical activity from the cerebral cortex. This is basically an invasive method of measurement where you can insert the needle down into the cortex and then record the signals. Electromyogram, which records the electrical activity produced by the muscles. Other examples of biosignals are EEG, which I would be speaking on, records the electrical activity from the brain. So you could see that with the help of an cap electrode arrangement, this is a standard arrangement where you can have low, medium, and low medium types of electrode cap, which suits the circumference of the head for a low circumference and for a medium circumference. So then you have another type of biosignal, which is electroretinogram, which actually records. So you can see here, it records the electrical activity of the retina in response to a light stimulus. You would be providing a photic flash or some sort of light stimulus and would be recording the electrical potential from the retina. Then you have oculogram, which records, see here, you can see that it records the corneoretinal standing potential that exists between the front and back of the eye. So nowadays we have provisions in many softwares to record, but you should have sufficient amplifiers for it also to record EOG and then subtract it from EEG signals to remove the EOG artifacts, because basically when we record EEG, EOG acts as artifacts in the EEG signal. So you can record EEG specifically and then subtract it for efficient analysis of EEG signals. Then we have ENG. It is a method to visualize directly the electrical activity of neurons from the central nervous system or from the peripheral nervous system. Then you have electrogastogram, which records electrical activity of the muscles and nerves in the stomach. So these are some of the typical examples of biosignals, which is recorded from the body. And there are many more examples: phonocardiogram, phonoplethysmogram, vibromyogram, vibroarthrogram, and so on. So there are multitudes of biosignals which are recorded and which is further used for analysis, which would help the or which would aid in a faster diagnosis. Okay, so we would come to biosignals. So these biosignals doesn't explicitly, not all, some of these signals doesn't explicitly give you information regarding the associated disease, but there are certain signals which give you information regarding the disease. If you observe the ECG signals by observing the PQRSTU waveform pattern, and depending upon the amplitude and depending upon the time period, the doctors can assess whether the person is suffering from some sort of arrhythmia or so on. And depending upon the different types of biosignals and depending upon its expressions, you can sometimes have visible information directly from the signal, but otherwise most of the informations are hidden or are subtle in the signal, which need to be extracted in order for a proper analysis. Okay, so signal conveys information about the behavior, so that is actually obtained from the recordings of the electrical activity, and that would always have the attributes of the phenomenon associated with the illness or the disorder. So it exhibits variation. So if the person is suffering from any sort of disease, you can see that there is a variation in the time and space, which will represent the status of a biological system. If the person is suffering from a disease, that would be very well evident when you make a analysis, not by visual observation, but there are certain signals which would directly give you information regarding the disease. Okay, now some examples of the signals are 1D signals and 2D signals. So 1D signals are EEG signals, EMG signals, ECG signals. 2D signals are all the image signals which are extracted for analysis of a feature extraction, which would help you to arrive at a conclusion whether the person or whether the signal gives you any information regarding the associated disorder inherent in the signal. So these are the different steps associated with the processing of biomedical signals. You have basically a data acquisition stage, then you have a pre-processing stage, then you have a processing stage, then you have a signal analysis, which would finally lead you to computer-aided diagnosis and therapy. So we would see the biomedical signals are acquired with the help of the transducers, which is actually fed to a preamplifier, because those signals which are being recorded are basically in few ranges. EEG signals are in the ranges of microvolt, and ECG signals are in the ranges of millivolt. So in order to record it, you can record it, but in order to have a faithful reproduction and its analysis, you should convert it into its voltage stages. So you will have to have amplifiers and filters, and then you would provide a sampler and a quantizer to have it converted from analog to digital, and then filters to remove the artifacts, because our artifacts always obscure the signals and the hidden information in it. So you will have to have the pre-processing techniques to remove the artifacts, and then you would have to apply the processing signal processing techniques to extract the events, or to detect the events and the components hidden in the signal. And then you have to analyze the features which have been extracted, and then you will have to either go for pattern recognition or classification, and then which would help you for a diagnostic decision. So all these are the steps associated with a computer-aided diagnosis and for a future therapy. So now I have said that I would be speaking mostly on the analysis which is conducted on the depression, and that too using EEG signals. So let me briefly give you an idea on EEG signals. EEG signals are electroencephalogram signals, because I've already represented it in the previous slide, so I have not put it here again. So EEG signals have been used by the researchers for the study of various events like sleep, epilepsy, reflexology, drugs, the anesthesia, effective meditation, music, and different types of neurological disorders. So when EEG signals have been used for detecting epilepsy, that is very conspicuous because of the high frequency jumps in the EEG signal when it is an epileptic seizure. But such a thing is not visible when you observe a signal from EEG signal from a person with depression. You would not see any high frequency jumps, or you would not be able to recognize anything or identify anything or any feature associated with the characteristics of depression. So for that, let me show you a signal. See here, this is a signal which gives you the normal state, This gives you the pre-seizure state. Pre-seizure means it is just prior to epilepsy, and this is the seizure state when the person is suffering from depression. See, so you can evidently make out that how it differs from the signal differs in a normal state and just prior to a seizure and during a seizure, and there will be slight differences post seizure also. So that is very evident in a signal from an epileptic patient. But you can see the waveforms which is shown below. Here you can see this is a normal signal which is highly nonlinear and non-stationary, and you cannot make out anything from the signal. Similar in the case of depression. So similarly, it is very difficult to make out any hidden trait associated with depression. So it is very essential to extract the features and then make an analysis from the depression signal, and then we will find out how it differs from that of a normal signal, and hence we would be able to decipher what is the characteristic trait of a depression signal. Okay, so this is a denoised EEG signal. You can see that these are all, see, but the doctors used to make a diagnosis based on observing this, but depression, till now people never used to detect depression from looking at EEG signals, and doctors are not at all are of opinion that you can detect depression from EEG signals, even though we say with all the literatures supporting it, and even our publications also support that, but still some of the doctors are not does not welcome the idea that EEG signals should be used for analyzing depression. So we always say that it could help you, it could aid you, or it could help in a faster diagnosis. So EEG signals, and also when you do, when you make an, record the EEG signal for analysis of depression, we could also identify if there is any other associated disorder. If you could see that the features are deviant from that what we have observed from a person exactly with just the traits of depression. Okay, so EEG signal is basically electrical activity of the brain, and it is recorded from the scalp, and it is a non-invasive method of measurement. And we as researchers, or being in the technical field, and if we do want to make a measurement, we can only have a non-invasive measurement to make a study. And I always suggest that it is always better to hire a lab person, EEG lab person, to make a recording rather than we do it ourselves, because when we make a recording, there is a chance of many types of artifacts creeping into the signal. And then even with use of many signal processing techniques for the removal of artifacts, it becomes, it would not be clearly, free from artifacts. So it is always recommended to hire an EEG lab expert to record EEG signals, if at all you are proceeding with research in EEG signals. Okay, so it actually measures the voltage fluctuations. It doesn't give you a particular, it doesn't give you a potential corresponding to particular electrode. It actually gives you the summation of potentials across or in and around the placement of the electrode. So, and it is recorded over a period of time. It is either recorded for 1 second duration, or it is recorded for 5 minutes duration, or 10 minutes duration, 24 hours. So when it is EEG signals being recorded for detecting an epileptic seizure, or for identifying the time instant of occurrence of a seizure, usually people would be hooked to EEG for a longer duration of time rather than minutes or seconds. It will extend to hours. Okay, and the characteristic traits in terms of amplitude and frequency of EEG signals are, the amplitude actually extends from less than 10 microvolt to over 100 microvolt, and the frequency extends from something between 1 hertz to over 100 hertz. Now, the different measurement methods which we have, and I have already told you, the one which we usually prefer to is the surface electrodes, where you can have these cup electrodes which can be placed on the scalp of the brain with the help of electrode gel. So you have to use electrode gel in order to firmly secure it, as well as to have a proper coupling of the electrical potential from the scalp of the brain onto the computer, or through the wires onto the machine into which it is being recorded. So that is a non-invasive method of measurement. Then you have subdermal needle electrodes, which is basically an invasive sorry, this spelling is wrong. So it's basically an invasive method of measurement, and we don't actually do this. We try to get data either from the database, or you can collect the data from hospitals for your study. And for these, the ground reference electrode is basically a metal clip electrode on the earlobe, or you can have standard electrode cap arrangements which can be provided on the scalp. which can be used for recording of electrical activity from the human brain. Then how the electrodes are being placed. You cannot randomly place the electrodes on any locations. You will have to strictly follow the 1020 electrode placement system, which is actually found out by taking the circumferential distance from the nasion, which is a dip just above the nose, and the dip which is just behind the head, and you actually measure the total distance and then divide it into 10%, which actually marks the frontopolar region, then the fronto region on the central midline, or on the the central line, which correspond to 20%, and the 20% up to the central portion, and then from the central to parietal midline, then to the occipital, and so on. And so this 1020 electrode placement system is a standard system which is adopted by the labs, EEG labs, for recording the EEG signals. But there are certain labs in foreign countries where they usually resort to 10 electrode placement system or 10-5 electrode placement system. But later they would use associated softwares to convert that into 1020 electrode placement system, which would sometimes reduce the number of electrodes when you map it from 10-10 or 10-5 back to 1020 electrode placement system, because 1020 electrode placement system is a standard accepted system of electrode placement for recording EEG signals from the scalp of the brain. So the montages which are usually adopted are unipolar and bipolar. When you say unipolar recording method, is you place an electrode on any of the respective 1020 electrode position at one of the electrode position, and the other would be the reference electrode. So your measurement would actually be the difference between the reference and the position at which you have placed the electrode. And it is different from the bipolar electrode placement system, where the bipolar actually records the potential difference between two successive locations at which you place the electrode. So you can either have a unipolar recording or you can have a bipolar recording. When you have a unipolar recording, if you want to have recordings from multiple locations, then you will have to have a placement of good number of electrodes. When it is sufficient that you want to strictly limit your recording of EEG signals from typical electrodes from the brain, then better you can go for a bipolar, where you will record it as a difference of the signals from two respective electrodes at which at the positions at which the electrodes are being placed. So EEG signals are basically having 5 different frequency bands. So usually for the analysis, earlier we could see that the analysis was done in a wholesome manner where it would be considered as an EEG signal as such. But now people are more interested in looking what is the difference which is happening in delta, theta, alpha, beta. So basically the EEG frequency band of 1 to 100 Hertz usually consists of different frequency bands associated with it, and the delta band, which is of 0.5 to 4 Hertz, is usually reflected in deep sleep or in babies, and theta of 4 to 8 Hertz is usually seen during the beginning stages of sleep or in young children. And alpha of 8 to 13 Hertz is usually seen in principally relaxed resting rhythm, or when the person is remaining with closed eyes. Beta of 13 to 25 Hertz is when the person is actively working, or when the person is highly active. And gamma, which is greater than 25 Hertz, is when the person is subjected to perceptions or under cognitive tasks. So EEG signals are still again, just as we have seen the classification of signals being nonlinear and non-stationary, EEG signals are also highly nonlinear and non-stationary in nature. And so we should always resort to advanced signal processing techniques in order to extract the features, in order to help the clinicians for a computer-aided clinical diagnosis. So this is just a picture just to get a feel of the EEG signals associated with different mental activities. during thinking, during resting eyes closed, during drowsiness, during sleeping condition, during deep sleep. But even if we observe all these waveforms, we are not able to make out anything. Okay, so it is very much required to use the signal processing techniques to extract the features and then make an analysis based on the features extracted. So there are different methods of analysis like time domain, frequency domain, time frequency domain. I have just limited only some measures in time domain like nonlinear methods, linear prediction, independent component analysis, mutual information, permutation entropy, multi-scale entropy, and there are many more methods which I have not listed the whole methods associated. And the frequency domain, I have just listed some of the spectral methods like non-parametric method, which is the Welsh method, parametric method, which is the Burke method, short time Fourier transform method. But there are many pros and cons associated with different types of methods. And hence we have the time frequency domain where we have wavelet transform, synchro-squeezing transform, and so on. So I would be just concentrating on the time domain and time frequency domain. And then we have pre-processing of signals. So I have told you as a part of the step that pre-processing is very important. Otherwise, it would obscure the results after the analysis. So it is very essential that we need to remove the artifacts from the signal in order to ensure a correct analysis. Okay, so what are the artifacts associated with the signal? So the noise and undesirable signals must be eliminated or attenuated in order to have a correct analysis and diagnosis. Okay, so the major sources of noise in the signals are artifacts, which we have the eye blink or eye movement. EMG signals are also an artifact for the EEG signals. Skin artifacts like sweating is again an artifact. ECG signals also, the thumping of the heart acts as an artifact for EEG signals. Power line interference of 50 hertz in our country, it's 50 hertz, so that is also acting as a artifact. The cable movements also pose as artifacts for the signals, and high frequency noise too. So you have to remove these artifacts or reduce these artifacts from the signal in order to have a accurate analysis. Then coming to processing of EEG signal. So I am just by representing two of the methods, I'm just showing that the time domain methods have proved efficiently that they could be used as potential, or these features could be used as potential biomarkers for the detection of depression. So I have just listed out only 2-3 methods. There are many methods which have been used for detecting or analyzing depression, where just fractal dimension, which reflects the complexity of the underlying brain activity, largest Liopanov exponent, which gives you the exponential rate of convergence or divergence of the nearby orbits. All these are the non-linear chaotic measures or time domain measures which has been used by researchers for detecting or extracting the features associated with depression. So Hurst exponent, which gives you the smoothness of the fractal time series, approximate entropy, which gives you the degree of irregularity or randomness. So you can very well observe that. See, the brown line gives you the line associated, or the waveform or the plot associated with the signals, EEG signals from a normal person, and this is from a patient suffering from a depression. So approximate entropy also. Similarly, all these measures have given us a very clear-cut distinction between the EEG signals from a depression patient and that from a healthy control. Now, the time frequency domain methods of characterization. So we have seen the wavelet transforms could be used for time frequency, and synchro squeezing transforms also. So I would be restricting it to wavelet transforms. So wavelet transforms could be used. So for wavelet, so what has been used for making a clear-cut distinction between depression signals and normal signals is by the use of multi-resolution decomposition. So you could have both multi-resolution decomposition and wavelet packet decomposition, but it is very clear that the information content in the EEG signals would be mostly restricted below 80 hertz. So it is better to restrict our studies to multi-resolution decomposition than going for a wavelet packet decomposition, because packet means it would further analyze the high frequency content. So since our frequency, the information present in the frequency content would be mostly limited to 80 hertz, it would be less than 80 hertz. So it is sufficient that we go for a multi-resolution decomposition, which will gives you information in both time and frequency. And by multi-resolution decomposition, it actually you convolves a signal with a high pass and a low pass filter. When it convolves a actual signal with a high pass filter, it would actually gives you high frequency components in it. And when it convolves with a low pass filter, it gives you the low frequency components in it, which are known as approximations. And the high frequency components associated with it are known as details. So once you extract the approximations and details, then you can use it for further analysis using some suitable measures. So here I have shown the results when relative wavelet energy and analysis has been done, and also using wavelet entropy. So using relative wavelet energy, you can see that this is the relative wavelet energy plotted for depression patients. You can see that these are the ranges of frequencies at the lower end, and these are the frequencies associated to the range corresponding from 16 to 128 hertz. So you can see that the depression patients would have are having a frequency corresponding to, or are having the relative wavelet energy corresponding to lower frequencies, or high value of relative wavelet energy corresponding to lower frequencies. And here in normal controls, you can clearly distinguish or demarcate these signals with the relative wavelet energy being very evident for high frequency components rather than low frequency components. So it is very well proved that relative wavelet energy is a good biomarker for making or distinguishing or demarcating the EEG signals of a depression patient from that of a normal control. And also wavelet entropy, sorry, this is wavelet entropy. Wavelet entropy has also been used, and here also you can see that the normal values are higher than that what is being observed in depression patients. Okay, so the analysis has been conducted using deep CNN. Apart from these time domain, frequency domain, time frequency domain measures, the latest deep learning techniques have also been used using deep convolution neural network, using the speed signals, and depression has been analyzed using support vector machine in employing fMRI images. So with all these studies, it has been asserted that depression effects are reflected mainly in the lower frequency ranges of 0 to 4 hertz rather than the higher frequency ranges as observed in normal brain, or in contradictory to what is observed in normal brain. So normal brain, we can see that the activity is reflected more in the high frequency ranges, but you can see that the depression effects are reflected more in the lower frequency ranges of delta and theta. So there have been many studies which has been done in depression using deep CNN, and also using image studies using support vector machine, using different sorts of classifiers like mid-naive Bayes, neural networks, and so on. So we would see what are the methods which have come up in classification of EEG signals of normal controls in depression patients. So there have been many techniques in neural network using machine learning networks, or shallow machine learning networks, like feed-forward networks and probabilistic neural networks, where probabilistic neural network had given an efficiency of only 46%, but feed-forward neural network had given a classification accuracy of 96.25%. But when it was done on a deep learning network using CNN, and explicitly done on a network with CNN and LSTM, you could see that the classification has been greatly improved by 99.3%, and with the second method of 99.12%. So the idea which I need to convey from these deep learning techniques or the machine learning techniques is that it always is decided by the recording or the acquisition method, depends upon the features that has been selected. If it is a deep learning technique where you employ the handcrafted features for its deep learning classification, then the number of subjects which has been included, the locations from which the signals have been recorded. So all these have a say in getting a classification accuracy. So apart from the handcrafted features that are being extracted, there are also learnable features which could be learned from the network by itself, which could also give you a better classification accuracy. So there are two methods, using handcrafted features and using learnable features. When you use handcrafted features, you would have to go for feature selection methods, because it is the computational burden goes on increasing if you use all the features that have been extracted for giving or for employing learning network to give you a classification accuracy. So better go for a feature selection method. There are multitude of feature selection methods which are available, like forward, supervised, unsupervised, which includes wrapper method, filter methods, embedded methods, which has got that forward feature selection method, backwards feature selection method, then classification methods, regression based methods. All these methods are available for feature selection if you go for a handcrafted feature selection methods. But if you go for a learnable feature method, then it would be highly conducive and would get you would also get you a classification accuracy, which will try to, the network will try to learn the features by itself from the patterns of the networks available. Nearing to the conclusion. Now, this is the hot topic where artificial intelligence and mental health. Okay. So why is that people have gone for AI in mental health, or have resorted to all these sorts of machine learning and deep learning techniques in detecting or in analyzing or in screening mental health? This is done with the hope for reversing the decline in mental illness as soon as we detect or diagnose a disease, and also to float new tools which are potent enough to diagnose and provide better treatment capabilities, and also serve populations at reasonable cost, and also lower cost of AI treatments over psychiatrists and psychologists having many number of sittings, and it will also speed up the needed treatment. With all these advantages, that AI has been introduced into mental health for providing an affordable diagnosis, which is highly economical and which is affordable to a common man. So the AI tools which have come up for screening mental health are Ginger.io's virtual mental health services, which includes both video and text-based coaching therapy sessions. And it is a mental health service where the people record both the video and the text-based, and coaching therapy sessions are also provided. And the outcome of it is actually shown in green. 72% is reported clinically significant improvements in the symptoms of depression, or by these therapy sessions, 72% of the people have reported they have improvement, or they could come from the clutches, or they could somehow improve from the clutches of depression. Then there is another service which is Quartet Health, which screens patient medical histories and behavioral patterns to uncover diagnosed mental health problems. So they have also claimed that has reduced emergency room visits and hospitalizations by 15 to 25%. Then you have Dr. Bot, which is just like a chatbot. It is a chatbot counseling AI tool, which is basically a text or a voice-enabled AI interface, which will root out people with substance abuse, depression, anxiety, and it also provides access to convenient and cost-effective care. Okay, so these are all floated with the common idea of providing a cost-effective care to people suffering from mental illness. Okay, so these are all being floated in US. Ginger.io's AI tool, Quartet Health, Dr. Bot. Then VBot, it's a chatbot developed by Stanford University. It treats depression and anxiety using a digital version of the 40-year-old technique of cognitive behavioral therapy. Because we have seen in our one of the slides that this behavioral therapy, that is a psychiatric behavioral therapy. So that is a well-versed technique, and that is being used in the tool which is being developed by Stanford University, which is known as WeBot, and it actually relies on the cognitive behavioral therapy, which is used for treating depression and anxiety disorders. Then there is Ellie, a virtual therapist developed by University of South California's Institute for Creative Technologies. Ellie's actions, motions, and speech mimic those of a real therapist, so the person doesn't have to approach a therapist, so he can reduce the, or he can keep away from the embarrassment caused when speaking to a person, his problems with a person on a face-to-face basis. So these Ellie's actions, motions, and speech mimic those of a real therapist, and it is able to diagnose post-traumatic stress disorder in soldiers. So the in military setup, they were using a different way of different method of analyzing the PTSD, but Ellie could easily diagnose the PTSD disorders in soldiers more efficiently than the setup which has been used by the military hospitals. Then there is Talkspace too. So all these provide better access and better care. But there are certain risks associated with all these, just like hackers, and because we know that because these are all being uploaded onto a database, and if it is being hacked, all the informations corresponding to a person get easily being tracked by the hacker. So that is one of the drawback associated when you go for a virtual therapy. And another thing is that the demographic restrictions, because when you train the AI network, or when you train the network, you actually give a sample for training the network, and that sample may correspond to excuse me, that sample may correspond to a typical sample group, and it cannot cover the whole of the demographic locations. So once when you float it, what happens is that if a person outside this demographic location comes in and gives his voice or a text piece or a speech or an image, it becomes very difficult, and it would sometimes falsely predict it. So there are some restrictions associated along with this, but the advantages are more when compared to the drawbacks associated with these AI tools in assessing the mental health. So these are all non-clinician based digital mental health services: chatbots, video and written content, gamified user exercises, and digital cognitive behavioral therapy programs, etc. So it's a good adjunct to clinical based virtual care. And it also allows 24/7 access for those with less intensive needs. So you don't have to get an appointment every time to visit a doctor or a psychiatrist or a mental health service. This you would have access 24/7, and you can have a direct interaction without coming in contact with the person. Okay, and it also provides a scalable solution. It increases the flexibility while improving access and convenience for consumers, and also provides high patient satisfaction. So earlier, the psychiatrist in foreign countries had difficulty in moving on to this new tool, but luckily the pandemic has promoted them to use this new tool to help the patients assess their situation, or assess the level of their symptoms, or help the clinicians also to provide a pharmacological assistance when diagnosed with a particular type of mental illness. Okay. So these are the references associated with these slides. Some of the references, not all the references, some of the references associated with the slides. So currently AI is the the new tool for assessing mental health, if at all, if the person finds it difficult to meet the clinician or a psychiatrist in person. So, thank you.
So
now
thank
it
you,
is open.
ma'am.
Yeah, thank you.
Thank you, ma'am, for this informative and amazing session.
Thank
So
you.
attendees who have any queries related to this topic can directly ask ma'am, or you can either write down in the chat box and it will be read out. So anyone with questions?
You're free to ask any question related to the talk. Maybe it's more of an information, and maybe if at all, if you go through the literatures or if you through the research papers, and if you have any queries, or when you come or when you encounter any problems when you do, if I am well versed with it, I'm sure and I'm ready to answer your questions.
Can I answer one question? Can
Yes,
I
sir.
ask one question?
Yes, sir.
Yeah, I am from JKLU Jaipur, currently at Canada.
Okay, sir.
First of all, I would like to thank you for a very informative and detailed session.
Thank you, sir.
It was very nice of you conducting this session.
Thank you, sir.
My question is more about rehabilitation, like
Okay.
diagnosis. So there are two parts here. One is diagnosis and one is rehabilitation.
Yes.
So you have addressed about therapy. So
Yes.
some sort of therapy. Now,
Yes.
the medical profession in general is very regulated, highly regulated, right?
Yes, sir. Yes, sir.
And self-medication, generally we say that it is not recommended.
It is not
But
advisable to.
it is not recommended. But at the same time, the world is progressing towards that because of shortage of doctors, shortage of
Yes,
rehabilitation facilities.
Yes.
And particularly in the US and such advanced countries, there is a huge mental health problem.
Yes, yes.
It's there in India too, as your figures show.
Yes. But it
at
has
least
not been widely reported. That's a problem.
Yeah, it is not widely reported.
Yes.
And also it is true that maybe the social structure in India is such that
yes, sir.
there's a lot of support, family support.
Yes,
whereas in US, actually, this crazy thing of shootout of 20, 30 people, this type of things have not happened in India, luckily. But there may be hidden things. So how do you think that, coming directly to the question, how do you think that your research can evolve into better tools for diagnosis part and rehabilitation part, like the treatment part? Can it be done with some sort of hybrid, like when you are diagnosing at the same time it can be treated with some virtual intervention of doctors? Because previously we had to go always to doctor. Now, for example, where I am currently in Canada,
yes, sir.
Here the doctor appointments are all virtual now. And
Yes,
doctor is advising virtually because there's no other go because of the COVID situation.
Yes, sir.
Now, what do you think that some sort of hybrid model can develop where the cost also can come down, actually, because the doctor can be involved still, and assuming that all the security and the encryption and all that is taken care, that is the basic premise, which is not your area of expertise, because there are
Yes,
network
sir.
security
Yeah,
people
I
and
understand. I
encryption
understand.
and
Yeah.
end-to-end. Even WhatsApp now claims end-to-end encryption.
Yes, sir.
So, what do you think that the possibility of a hybrid model of just like we say blended learning, where there is there's
Yes,
sort of
sir.
a facilitator, teacher, and also the student is learning. It's called student-centered learning, but at the same time, facilitator is always there to help. So some such hybrid model of doctor and the online technology, AI, and all that. Do you see something?
Yes, sir. Actually, all this research are done keeping in view of providing a faster and a computer-based diagnosis, so that without multiple sittings, the doctor can effectively start the treatment on initial diagnosis itself. So this would help in arresting the progression of the mental disorder or the illness. And suppose we can also, by these methods, we can also actually classify the signals, whether the person, if you are recording the signal. But the thing is that when you have a virtual way of analyzing, it is very, when you do a virtual analysis, see, when the person is going for a virtual mode of appointment, it is very difficult to take an EEG signal and make a measurement. But these sort of tools would help you only if you could record the electrical signal from the brain. Otherwise, it should always be a sort of interaction either with the AI tools or must be with the clinician.
Yeah. So some hardware is required. So that's where the bottleneck will come in terms of hardware. Like something has to be
yes, sir.
low cost and affordable. It's like, for example, people are having blood pressure monitoring machines at home now.
Yes.
So for self-diagnosis, something low cost should be there, which can be attached like a cap. And then that can be probably virtually captured. And then maybe there's a scope for some sort of commercial product, maybe.
Yes, sir. Yes, sir. Those some of the AI tools which I have mentioned in my slides, some of them actually captures the text and video images of the person with a mental illness, and then are able to detect or screen the mental illness. But there is a drawback with what I have mentioned earlier, that suppose if the network is trained with a sample of data or a sample taken from a particular population corresponding to a particular demographic location, then it will fail if that AI tool is used for some other country with a different demographic location. Suppose if the color of the person, the race of the person, the slang of the person, even if you speak English, the slang, everything, if that changes, sometimes the tool fails. So there is a drawback also associated, or a limitation for these tools in these aspects too.
Yeah. Okay, thank you. But just one more corollary question,
Yes, sir.
if you don't mind.
Yes, sir.
I was wondering, because your research is mainly on the the biosignals, but you also touched upon the eye based some sort of cues and all that. So because camera technology and the video is very much established, well established.
Yes, sir.
So do you see any scope for getting the mood and expression of the face? By that, can there be any diagnosis of a depression of a person?
Yes, some time back, I have read in a newspaper in scientific column that university in US is trying to develop a app which can extract the facial expression and detect whether the person is suffering from depression. I don't know how well it has progressed, but I have read a small clipping from the newspaper.
Okay, so there's some scope in that direction. Thank you
very
much.
There is scope. There is scope.
Thanks.
Thank you, sir. Thank you, sir. That was nice of you to give me also sufficient information. Thank you, sir.
Anyone else?
Okay, if there are no more questions, I think we shall wind up.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So with this, we come to the end of the session. Thank you so much, ma'am, for your valuable time and presence and providing us with an informative and very good, amazing session. Thank you so much, ma'am.
Thank you very much. Thank you. Thank you.
Thank you. And thanks to all the participants who have joined us here today. Thank you. Thank you for your cooperation. Have a good day. Thank you.